Turning 65 doesn't just come with a birthday cake. It comes with Medicare decisions. Medicare, when to enroll, what are your coverage options, and how to avoid penalties. This is episode 20 of Uncharted Wealth Podcast, Medicare Basics, what you need to know before age 65. Hello and welcome to SWBC's Uncharted Wealth Podcast, where we help you explore the financial landscape and navigate your journey to and through retirement with confidence and clarity. I'm Mike Walters. I'm a certified financial planner and a wealth advisor here at SWBC. And today we are going to be covering the basics of Medicare, what it covers, when to enroll, and how to avoid some costly penalties when you do enroll. This is not to be a deep dive into every single detail of Medicare, but it's the essential information that you need to know before age 65. Now, the first part of Medicare is Part A. This is your hospital insurance, okay? This is going to cover your inpatient hospital stays, nursing care, hospice, and some home health care. Okay, and it's usually free as long as you've paid into Medicare over the last 10 years. It's not free care, okay? There still are some costs associated with Part A, such as deductibles and coinsurance, which you should already be used to if you've been dealing with health care coverage for your entire working life. But just be aware that there are still some out-of-pocket costs when it comes to Medicare Part A. Now, Medicare Part B, this is where it gets more important. Part B is your medical insurance. This covers your doctor's visits, outpatient care, some preventive services, and some home health. Now, you do have a monthly premium required with your Part B, and guess what? It's based on your income. So if you make more or you have a higher income, you are going to pay more on your Medicare Part B premiums. There are late enrollment penalties if you don't sign up when you're supposed to, so you're definitely going to want to be on track of that. And this is where people mostly get tripped up, especially if they are delaying their enrollment benefits because they're still working. So later in this episode, we're going to break it down when you should be enrolling for this. Part D is for prescription drug coverage. Now, Part D is completely optional, but if you are already taking prescription medications, or you think you might in the future, who knows, nobody knows, then Part D may be something that you need to look at. Now, these plans are offered by private insurers, okay? So that means the plans can vary wildly with coverage options and costs. And also to think about, there are late enrollment penalties for this as well. So if you don't sign up when you were initially supposed to, then there may be some penalties there as you get through it. Now, Part C of Medicare, technically there really isn't a Part C, but this is where they lump in Medicare Advantage plans. These plans are all-inclusive. They replace Original Medicare, which Original Medicare is Part A and B, okay? And they often include prescription drug plans, so it can include Part D as well. These are also offered by private insurers, so again, coverage is going to vary, costs can vary, but depending on where you live, you might not have to pay anything for these plans, which is awesome. A lot of times these plans also include extra benefits like dental coverage, vision coverage, or even sometimes gym membership, so could be very good for your situation. It's important to understand these trade-offs when you're looking at a Medicare Advantage plan, again, because there still might be some deductibles in coinsurance, but again, variability is going to be different on these plans because they are offered by private insurers. Now, the last part of Medicare is what they call Medicare Supplement plans, or also known as Medigap plans. These are also provided from private insurers, but these plans are there to cover the gaps in Original Medicare. So if you have Medicare A and Medicare Part B, and you are supplementing with a Part D prescription drug plan, then you might also look at a Medigap plan to cover some of those gaps, usually just to cover some of those out-of-pocket expenses like deductibles and co-insurance. Now, there's something very important to remember about supplement plans. Number one, you cannot have a supplement plan and an Advantage plan at the same time, so you're really going to weigh the benefits of which one is going to be better for you. And number two, there is a specific period where you need to enroll in these Medigap plans. It's called the Medigap Open Enrollment Period. It's the first 6 months after you become eligible for Medicare, and this is the only time where you can apply for a Medicare supplement plan, and they cannot hold any prior health issues or pre-existing conditions against you. Okay, basically means it's almost a guarantee issue no matter what your health problems may be. I guess we'll just say it that way. So now that you know about the different plans of Medicare, the different parts of it, I'd like to remind you that if you have not subscribed for this podcast, now is the time. Feel free to give us a call, shoot us an email, or check out our very new landing page that will be in the description of this video, so you can access more content and meet with an advisor if you need to. Now, with these Medicare plans, the timeline and enrollment windows are going to be very important, okay? And so I've got some notes here just to make sure I don't get this wrong. There's the IEP, the SEP, the AEP, and the GEP. I'm going to break those down for you right now, okay? So get out your pencils and write this down. IEP stands for Initial Enrollment Period. This is the 7-month window around when you turn 65. So the 3 months before your birthday, the month of your birthday, and the 3 months after. This is your initial time to sign up for Medicare. The SEP stands for Special Enrollment Period. These are for our folks that are still working and covered by a qualified healthcare plan when they turn age 65. So when they eventually retire and come off of that qualified healthcare coverage, they have a special enrollment period where they can get into Medicare without any of the late penalties. AEP is the annual enrollment period, okay? This is from October 15th to December 7th of every single year, where this is where you can make changes to your Part D prescription drug plans or your Medicare Advantage plans if you are already part of those. And then the last one is the GEP, the General Enrollment Period. This is from January 1st to March 31st of every year. We want to avoid the General Enrollment Period. Why? The only time you're actually going to do something in the General Enrollment Period is if you missed your initial enrollment period and you don't have a special enrollment period to go in, okay? So if you missed signing up for Part B, you didn't sign up when you were supposed to, you were being a silly goose, then you have to go into this General Enrollment Period, which is also Medicare Advantage Open Enrollment Period, where if you have an Advantage plan, you can switch to a different plan as well. But the key thing to remember about your General Enrollment Period is if you didn't sign up for Part B, this is when you have to do it, and this is where they're going to hit you with those late enrollment penalties that, guess what, they stick with you for life. So you do not want to mess that up. And now on to our uncharted territory for today's episode. Now for today's uncharted territory, I want to just really hone in on Medicare is not free and it's not simple if you think about it. Now the first part of this is because of IRMAA penalties. Now I've talked about this in past episodes, income-related monthly adjustment amount. You remember earlier when I talked about people that make more income have to pay higher Medicare premiums? This is why. If you make a certain amount of money and you hit this IRMAA threshold, even if it's only $1 more, you have to pay an extra IRMAA surcharge on your Medicare premiums. So my lovely production crew is going to bring up a graphic right here that has those surcharges so you can determine or see what these surcharges are. Second thing I want you to know is that original Medicare does not cover everything. Remember, original Medicare is Part A and Part B. You can get away with not having an Advantage plan or a supplement plan, but you need to know that your coverage is going to be limited. You're not going to have much long-term care coverage. You're probably not going to have dental, vision, or any of these other benefits that are usually covered with an Advantage plan or supplement plan. Retirees can be surprised about what your out-of-pocket expenses end up being if you don't have one of these plans. And last, Medicare is a planning conversation. This is why I'm talking about Medicare on a retirement planning focused podcast. It's part of the conversation. Your income, your tax strategy, and even Roth conversions can affect what your Medicare premiums are going to be. So planning ahead is essential to help you avoid surprises in any of those penalties we talked about. So the key takeaway for today's episode is that Medicare is a significant milestone when it comes to retirement planning. Not just your 65th birthday, it's a significant retirement planning thing, okay? But it's also a minefield if you're not prepared. Okay? Understanding the basics can save you money, stress, and missed opportunities later. So what I would encourage everyone to do is, number one, mark your calendars for when your initial enrollment period is for Medicare. You want to make sure you have that figured out. Number two, review your current healthcare coverages. What are your current prescriptions? What doctors do you like seeing? So on and so forth. Because once you get to age 65 and on Medicare, those things are going to change. And if you don't want them to change, you're going to need to see which plan are going to cover those items. And then last, talk to a financial advisor or a Medicare specialist to build a personalized plan for you. So, if you are approaching your 65th birthday and you would like to discuss your Medicare options, feel free to reach out to us at SWBC Wealth Management, and an advisor can definitely help you with your Medicare planning. Now, thank you for joining us on the 20th episode of the Uncharted Wealth Podcast. Disclosure time. Everything that I say on these podcasts is not to be taken as financial, tax, or legal advice. Consult with a professional. All my opinions are my own, not of SWBC or its executives. Remember to be kind to yourself, love each other, and share this with your mother, your brother, your aunt, or your uncle, cousin, and even your best friend. We'll see you next time. Peace. My hands is sweaty. Arms. There's vomit on his sweater? Already? Yep.
5, 4, 3.
Investing involves certain risks, including possible loss of principal. You should understand and carefully consider a strategy's objectives, risks, fees, and expenses, and other information before investing. The views expressed in this commentary are subject to change and are not intended to be a recommendation or investment advice. Such views do not take into account the individual financial circumstances or objectives of any other investor that receives them. This information should not be considered a solicitation nor a recommendation of an offer to provide any service in any jurisdiction where it would be unlawful to do so under the laws of that jurisdiction. Past performance is no guarantee of future results. Please consult with your individual tax professionals and/or attorney for additional information.